1% of people in America are using prednisone at any time. 1 in 100 people are suffering just like you. I'm Dr. Megan, the prednisone pharmacist, and I too took prednisone long-term. Prednisone long-term is defined as anything longer than 3 weeks. So who's on it for more than 3 weeks? That's what I'm going to talk about today. First, the thing to understand about prednisone is steroids, like prednisone, are supposed to be used short-term because they come with so many side effects. But if you have a condition that's so terrible that it might kill you or cause immense suffering and pain, then that's a good reason to continue taking it long-term. The main reasons are autoimmune conditions and inflammatory disorders. And almost any kind of doctor can prescribe prednisone. So, prednisone is used by endocrinologist doctors for things like adrenal insufficiency, by rheumatologist doctors for rheumatoid arthritis, lupus, polymyalgia, rheumatica, and other big words. Pulmonologists are the lung doctors. They use it for things like COPD, or chronic obstructive pulmonary disorder, asthma, sarcoidosis, and other breathing problems long-term. Allergists and immunologists use prednisone for their patients who have chronic rhinosinusitis with nasal polyps, allergic rhinitis, allergic disorders, and eosinophilic disorders. So many different ways that people are using prednisone. The next type of doctor is the kind of doctor I had, a hematologist. Hematologists use prednisone for things like what I have, immune thrombocytopenia, or other blood conditions. Gastroenterologists, the gut doctors, they use it for inflammatory bowel diseases like Crohn's disease or ulcerative colitis. Dermatologists or skin doctors use prednisone for psoriasis or rashes, like atopic dermatitis or eczema. Neurologists, the nervous system doctors, they use it for things like muscular dystrophy, myasthenia gravis, multiple sclerosis, and other really long words. The kidney doctors, the renal disorders include FSGS. Cardiologists prescribe it for pericarditis and sarcoidosis. Eye doctors prescribe it for uveitis and multifocal choroiditis. Finally, solid organ transplant doctors prescribe prednisone to help keep the organ transplants, like heart, lung, and kidney transplants. So now that you know what prednisone is used for long-term, I'd like to know, was yours on this list? And if it wasn't, what do we need to add to the list? Because guess what? There is no great list out there of all the reasons people use prednisone. And you want to know why? Because prednisone is this really old drug. It was approved in 1955, before they had to do great tests. And so pretty much anybody uses it for whatever they want, but there's no perfect list of what it's being used for. So if I didn't mention what you're using it for, let us know below, and we will add it to this list I'm making on my blog, prednisonepharmacist.com. You can see what it's FDA approved for and these other conditions that are maybe not FDA approved for it, but people are using it long term. Comment below, and if you found this helpful, please like and subscribe to my channel. Signing off as Dr. Megan, your prednisone pharmacist.